remember the time when Stanford required its employees to take 12 furlough days over a 10-week period, which amounted to a 20% pay cut during the first week of the pandemic? At the time, Stanford called it a shared sacrifice. But many of the workers that were actually affected by the cut and the pay reduction made between $55,000 and $65,000 a year, or that time when only 7 medical residents received the first round of COVID vaccines that were provided to the hospital, while the remaining nearly 5,000 vaccines were administered to non-frontline workers. Stanford has a long history of screwing their employees over, which leads us to what is currently going on in the headlines.
Hi there, yeah. So right now I'm in Palo Alto on the Stanford Hospital campus, and as you can see behind me here, thousands of nurses out on strike. The nurses saying the hospital needs to step it up and increase their compensation and their benefits. The hospital says they believe they've offered a fair compensation package, and they're hoping to resolve this as soon as possible.
So, what are some of these demands, and what has the counterproposal been from Stanford? As of the most recent talks, the hospital's negotiators are offering the nurses a 12% raise over the next 3 years, while the nurses union is asking for 20%. The two sides started at 10% and 24% respectively, which just goes to show that the nurses have dropped their proposals significantly. If you take into account the fact that the annual inflation rate for the United States is 8.5% as of March 2022, and it's the highest it's been since December 1981. This week, nearly 5,000 nurses at Stanford Healthcare and Lucile Packard Children's Hospital in Palo Alto, California went on strike as they negotiate for better pay, more staffing. The union says that 93% of the nurses voted to authorize the strike, and that's something you gotta commend these California nurses for. When they don't get their way in the bargaining table, they are united. When we worked in New York City, I remember going through contract negotiations and our union reps putting a strike up for a vote because the wage increases being proposed by the hospital negotiators were abysmal, and only 78% of the nurses voted to go on strike. This is why New York City nurses earn a lot less than California nurses, even though the cost of living in New York City is higher than most other cities in the United States. The nurses working at Stanford say that profits spiked at Stanford and other large healthcare systems even during the ongoing COVID-19 pandemic. According to the university's own 2021 annual report, revenues at the two hospitals exceeded expenses by $845 million, compared with $107 million in 2020. In fact, Stanford has so much money to spare, they are even going as far as offering nurses up to $15,000 per week to replace the nurses that are currently on strike until they choose to end the strike and return to work. If you're a nurse desperate to make a quick buck by working as scabs during the strike, just understand that doing so not only hurts the nurses you are replacing during the strike, but it also hurts the profession overall, and it undermines those of us that believe we deserve to be paid a living wage that is able to keep up with the rate of inflation. And it undermines those of us that believe we deserve better staffing and safer working conditions. Another thing that needs to be considered by these hospital administrators is that the median home cost in the Stanford area is $3.4 million, while the median home cost in all of California is around $684,000. So, when nurses ask for higher wages here, is because they can't even survive on a single income in that area. And believe it or not, they are also considered middle to low income earners in that area. So what are your thoughts about the ongoing strike? Do you think these nurses are overpaid? Or do you think the strike is justified? And if you like this video, you're probably going to like our video on why nurses are quitting the profession.